Hello, my name is Svetlana with Gaia Speech, and I wanted to make a quick video about voice disorders or dysphonia. And something I've been noticing from my clients that I work with dysphonia, whether it's with children or adults. One thing that really I feel is crucial to even like should be the starting point of therapy is not the vocal folds themselves. So one thing I notice is the vocal fatigue, the muscle strain, the exhaustion of the voice. And I generally hear it in their chest, in their lower throat. So it's not even reaching the vocal folds. So considering somebody has dysphonia or whatever kind of voice disorder, how much work they need to put in to get their sound out or to speak a way that they kind of in their mind, they perceive, okay, somebody's hearing me. So a lot of times they have to put, the patient has to put in a lot of force to sound a certain way, hoping somebody will hear them. A lot of times they try to increase their volume, try to speak more forceful, more louder, whatever it is. And that is going to cause a huge amount of muscle strain. At first I hear it kind of in their chest and in their lower throat. I sense this fatigue and tiredness and just kind of just even talking to the client in the very beginning, they would admit that they sound pretty fatigued. They feel pretty fatigued in addition to sounding fatigued. A lot of times if they have to put in this much force, they have to utilize their upper chest muscles. So that means their back muscles are involved, their shoulder muscles are involved to get the sound out. And chances are they're having a lot of muscle tension in their abdomen. So why do they have tension in their abdomen and in their back? Well, most likely because they're putting in so much force and pressure, they're not breathing correctly. They're not using their diaphragm correctly. They're probably or most likely using their upper body. So that means they have to use all the muscles in the upper body. And those muscles should not be used during regular breathing and speaking. They're usually just used during exercise or when you're running away. That's what it's there for. But a lot of times people do not realize that they're breathing through their upper body and they're either ignoring their diaphragm or squeezing it tight. So I usually target those two aspects first before I even touch the vocal folds, before we even do like resonance and whatever other exercises there might be to target the vocal folds specifically. You got to let go of those muscles because otherwise, what's the point? If you just train the muscles, but everything else is tight and the habit to speak is already in there. Even if you're targeting the vocal folds, the patient already developed certain habits over time to speak a certain way. So it's kind of, to me, it just sounds almost useless. The first steps I usually go to is correcting the breathing, body awareness, releasing the muscles, learning how to breathe through the belly, and undoing those habits. Like some people have a habit, like if they have a phlegmy throat, to like push it out with their vocal folds. Well, that's damaging actually. And also if you don't know how to use your diaphragm, well, then you're squeezing muscles really tight, and how does that really help you? Also mindset. What is going through the person's mind? If they have already habits to put a lot of pressure on themselves that they've had even before the voice disorder happened, or they've had a habit to be loud, to speak loud, to yell, and that might have caused a voice disorder. Well, how even if you do a little exercise on the vocal folds, how is that going to help the habit? The habit is still there. So for example, I have a 9-year-old student with dysphonia, and this is what we've been doing: breath work and self-awareness and becoming aware of the habits. And he admitted to me himself that he had a tendency to just scream. He walked into a room, he wanted to get his parents' attention, he would just scream because there's other siblings, and he was trying to get his parents' attention. And with awareness, he realized himself that that's not good for him at all. So that habit was reduced. And then we also discovered, well, he has a tendency to scream during recess, the entire recess, so it's however long it is, twice a day. And then he has football practice afterwards, all that time screaming. Well, how's that not going to cause dysphonia and muscle strain? So we're undoing those habits. Then further going deeper in, and he kind of realized, oh, wait, at school, because he goes to a yeshiva, they have a class where they're, I forget what it's called, but they're studying the Torah, I think, and they have live debates. Everybody's screaming and talking over each other. Well, for him, he can't do that right now. He has to become more conscious and not put in so much work. He can still debate, he can still talk, but he needs to become more mindful about the muscle tension and the amount of force and tightness he's applying to his belly. It's all in the belly. So yeah, these are just observations I made. These are the strategies that I've been using, and I've had positive results. Let me know if you have questions, and if you have a dysphonia, I would love to work with you as well if you like these approaches.